Alright guys, so there's another type of anemia which we'll be looking at, and this is the what? Microangiopathic hemolytic anemia. Microangiopathic hemolytic anemia. Alright? So it's quite a rare type of anemia. And most of the times when you see it being written, it's written as what? MAHA. MAHA. Alright? So we said that it's a type of hemolytic anemia. Now when you're saying hemolytic, hemolysis, okay, it's a type of anemia where the red blood cells are broken down. Alright? So we said that it's a type of hemolytic anemia which is caused by what? Mechanical destruction of red blood cells as they pass through small blood vessels with damaged endothelium. So the blood vessels are small, and the endothelium, that's the inner lining, alright, inner line of the red blood cells is kind of like rough. Okay, so as the inner lining is rough, it's kind of like what? Destroying the inner line of the blood vessels is rough. So that's what is now destroying the red blood cells, right? So what is the mechanism? So that the endothelial layer of the small vessel is damaged. So this is now leading to what? Fibrin deposition and platelet aggregation. So as red blood cells travel through these damaged vessels, they are fragmented because it's like we are going through a mesh. Do you understand? It's just like going through a mesh, like a grinding engine. Alright? So there's schistocytes, so there's presence of what? Fragmented red blood cells. That's what they call schistocytes. Schistocytes. Schistocytes, right? So causes, we said that conditions such as what? Hemolytic Uremic Syndrome, Thrombotic Thrombocytopenic Purpura, Disseminated Intravascular Coagulation, Malignant Hypertension, Systemic Lupus Erythematosus can all result into this microangiopathic hemolytic anemia. So what are the symptoms? The person will be feeling all the symptoms of anemia, like fatigue, weakness, shortness of breath, pallor, and this is due to what? Reduced red blood cell count. Then there will be hemolysis, that's jaundice, dark urine, increased bilirubin levels, right? Then for underlying conditions, well, if we are saying all these conditions can cause it, then you'll be having symptoms of those conditions too, right? So diagnosis is blood smear, where you get to see schistocyte on the blood smear. Laboratory test, where you are testing for what? Elevated levels of lactate dehydrogenase. Then you check for low haptoglobulin, increased indirect bilirubin. Okay, so you can also do imaging tests like what? MRI scans, CT scans, just to assess for organ involvement. Okay, so treatment is what? Plasmapheresis, alright, supportive care like blood transfusion, iron supplement, management of any underlying condition that is causing it. Alright, medication is when you are having all those corticosteroids, immunosuppressants, and other drugs that are depending on the underlying cause, right? So the prognosis varies on the underlying disease condition that is causing it, alright? So that's it for this definition, characteristics, causes, symptoms, diagnosis, treatment.